Hello everyone. Today we are going to discuss radiographic imaging of the abdomen, specifically the KUB system. KUB is an acronym for kidneys, uterus, and bladder, which are the primary components of the urinary system, along with the urethra, and in men, the prostate. But even though this system deals primarily in urine, I can promise that you're in for a treat. If you'll please direct your attention to the leftmost image on this slide, you'll see a basic anatomical depiction of the primary components of the KUB system. The kidneys are the bean-shaped organs in the middle of the abdomen, and the ureters are the two tubular structures connected to the kidneys that extend down the length of the abdominal cavity into the pelvic region where they both connect to the bladder. Radiographic imaging of the KUB system is done as a diagnostic procedure to address certain types of abdominal pain or to assess the structure of the urinary system for abnormalities. Typically, the first type of diagnostic imaging performed on a patient's KUB system is an X-ray, an example of which is the middle image on the slide. The kidneys are highlighted to make them easier to identify. In an X-ray imaging procedure, the patient is typically lying on their back on the imaging table with their arms at their sides in what is known as the supine position, and the image is taken on full inspiration, which is when a patient is instructed to take a deep breath and hold it while the image is taken. This causes the abdominal organs to compress and allows all renal organs to be visualized in a single image. Some common ailments with the KUB system include masses, such as kidney stones, perforations, and obstructions. Moving on to the third image on the slide, you can see an X-ray of a KUB system that has multiple kidney stones due to extensive calcification. Someone needs to drink more water, huh? But in all seriousness, a condition like this can have several underlying causes. And thanks to the science of radiographic imaging, this patient can now be diagnosed and move on to the treatment of their condition. There are also many other methods for imaging the KUB system. In the right-hand column, you can see examples of a CT scan, sonogram, and MRI respectively. Each imaging method has its own advantages and disadvantages, so the method being used will depend on the specific disorder and the needs of the radiographer ordering the scans. Radiographic imaging of the abdomen's KUB system is important because it is the first step toward obtaining treatment of any urinary issues a patient may have, and contributes toward an overall better quality of life for patients. While there are hereditary links to some urinary issues, many issues can be prevented simply with a proper diet and exercise. So do your body a favor, everyone, and get fit and stay hydrated. Thanks for listening.